Imagine a disease where your own immune system becomes your greatest threat. This is the reality for many living with lupus. In this journey, we'll uncover the mysteries behind systemic lupus erythematosus, revealing how it affects the body and why its symptoms are so unpredictable. After our opening, let's preview the journey ahead. We'll explore what lupus is, its causes and triggers, the underlying mechanisms, how it presents and is diagnosed, and the organs it can affect. To begin, we need to understand what lupus really is. This topic will reveal how lupus got its name, what makes it systemic, and why it stands out among autoimmune diseases. Let's start with a clear definition. Systemic lupus erythematosus is an autoimmune disease that affects multiple organs and often causes red skin lesions. This definition highlights the complexity and reach of lupus, setting the stage for our deeper exploration. Here's how the name and origins of lupus reveal its nature and the symptoms it causes. Systemic means that lupus impacts multiple organs throughout the body, making its effects widespread. Erythematosus refers to the redness of the skin, often seen as visible lesions in lupus patients. Lupus comes from the Latin word for wolf, possibly because early descriptions likened skin lesions to a wolf bite. Lupus is not limited to the skin. Its reach extends to many organs, creating a complex clinical picture. Skin involvement in lupus often appears as red lesions, especially in areas exposed to sunlight. Lupus can affect a wide range of organs, including the kidneys, joints, and heart, making it a truly systemic disease. Now that we know what lupus is, let's explore what causes it. We'll look at the interplay between genetics and environmental factors and examine the triggers that can set lupus in motion. This question challenges our understanding of the immune system. Why would it turn against the very tissues it's meant to protect? The answer lies in a complex interplay of genetics and environment, and it's a puzzle that continues to intrigue scientists and doctors. Genetic factors play a crucial role in lupus, affecting both risk and how the immune system responds. Susceptibility genes increase the risk of developing lupus by altering the immune system's behavior. Impaired clearance means the body is less effective at removing apoptotic bodies, leading to more nuclear antigens circulating. Environmental triggers can set lupus in motion, especially when combined with genetic susceptibility. UV radiation from sunlight can damage cells, triggering lupus symptoms. Cigarette smoking is associated with a higher risk of developing lupus. Viruses and bacteria are considered potential infectious triggers for lupus. Some medications, such as procainamide, hydralazine, and isoniazid, have been linked to lupus onset. Sex hormones, especially estrogen, may explain why lupus is more common in women. Gender and age patterns reveal how lupus risk changes throughout life, highlighting the influence of hormones and genetics. Lupus is about 10 times more common in women during their reproductive years. In childhood or after age 65, lupus is only 2 to 3 times more common in women than men. With causes and triggers in mind, let's dive into the mechanisms behind lupus. We'll trace how the immune system turns against the body, leading to inflammation and damage. Let's trace the chain of events that lead from cell damage to widespread inflammation in lupus. The process begins with an environmental trigger, such as UV radiation, causing cell damage. Damaged cells undergo apoptosis, releasing nuclear antigens into the body. Impaired clearance means more nuclear antigens remain in circulation, increasing the risk of immune response. The immune system recognizes these nuclear antigens as foreign, triggering an attack. These cells produce anti-nuclear antibodies, which bind to the nuclear antigens. These antibodies form complexes with the antigens, which can deposit in various tissues. Deposited complexes cause local inflammation and tissue damage, leading to lupus symptoms. Lupus symptoms arise from both type 3 and type 2 hypersensitivity reactions. each causing distinct forms of tissue damage. Type 3 hypersensitivity reaction involves immune complex deposition, resulting in tissue damage. Type 2 hypersensitivity reaction occurs when antibodies target specific cells, such as red and white blood cells or phospholipids. Now, let's look at how lupus actually presents. We'll explore its classic symptoms, the diagnostic criteria, and why diagnosis can be so challenging. Imagine facing a disease that can strike anyone, at any age, and with symptoms that change from day to day. This unpredictability makes lupus a real-life challenge for patients and doctors alike. Here's how lupus typically presents, with fever, joint pain, and distinctive skin rashes. Fever is a common general symptom in lupus, often signaling inflammation. Joint pain, or arthritis affecting 2 or more joints, is a frequent complaint in lupus. The butterfly rash, appearing over the cheeks and sparing the nasolabial folds, is a classic lupus sign after sun exposure. Notice how these criteria align in surprising ways, requiring a combination of symptoms and lab findings for diagnoses. Malar rash appears on the cheeks and spares the nasolabial folds, often after sun exposure. Discoid rash is chronic and plaque-like, forming patchy redness and sometimes scarring. Photosensitivity describes rashes that occur after sun exposure, typically lasting a couple of days. Mucosal ulcers affect the inner membrane of the mouth or nose. Serositis is inflammation of the lining around organs, such as the lungs or heart. Arthritis requires inflammation in 2 or more joints to meet the criteria. Renal disorder is indicated by abnormal amounts of protein in the urine. Neurological disorder can manifest as seizures or psychosis, linked to autoantibodies. Hematologic disorder includes anemia, thrombocytopenia, and leukopenia, depending on which blood cells are targeted. Anti-nuclear antibody is highly sensitive for lupus, but not specific, as it appears in other autoimmune diseases. Other antibodies, such as anti-Smith or antiphospholipid, can also be present in lupus. Finally, let's examine how lupus affects different organs. We'll see the range of damage it can cause, from skin lesions to kidney inflammation and neurological symptoms. Lupus often targets the skin and mucosa, producing visible and painful symptoms. Skin lesions in lupus include malar, discoid, and photosensitive rashes, often appearing after sun exposure. Mucosal ulcers affect the mouth and nose, adding to the discomfort and complexity of lupus. Lupus can inflame the serosa and heart, sometimes leading to unique complications like Libman-Sacks endocarditis. Serositis is inflammation of the lining around organs, such as the lungs and heart. Lupus can affect any layer of the heart, including the pericardium, endocardium, and myocardium. Libman-Sacks endocarditis involves vegetations, or clumps of fibrin and immune cells, forming on the mitral valve. Joints and kidneys are frequently affected in lupus, leading to chronic pain and potential kidney failure. Arthritis in lupus means inflammation in multiple joints, causing pain and stiffness. Renal disorders include proteinuria and diffuse proliferative glomerulonephritis, both serious kidney complications. Lupus can also impact the brain and blood, causing neurological and hematologic symptoms that complicate treatment. Neurological disorders, such as seizures and psychosis, can result from autoantibodies targeting brain receptors. Hematologic disorders include anemia, thrombocytopenia, and leukopenia, depending on which blood cells are attacked. Lupus remains a complex puzzle, challenging our understanding of the immune system and the human body. Ongoing research and greater awareness are essential for improving outcomes in lupus as we continue to unravel its mysteries and support those affected.